very pleased to see all of these people here in attendance this afternoon. Thank you very much for taking time out of your afternoon to visit with us. My name is Catherine Wells, and I am the Director of Public Health for the City of Lubbock. This afternoon, we'll be providing an update on our preparedness activities around COVID-19, or otherwise known as the novel coronavirus. We are closely monitoring this situation and are following our long-standing public health plans that have successfully been used to respond to outbreaks in the past, such as with H1N1. In addition to my update, we will also hear from our local health authority, Dr. Ron Cook, and the city manager, Mr. Jarrett Atkins. Got a promotion. And we will also have time at the end to have questions and answers. To start, there are no confirmed cases of COVID-19 in Lubbock or in our surrounding region. Over the weekend, new cases of COVID-19 were reported in multiple states. Some of these individuals had no known travel history or contact with ill persons. This indicates that there is some local transmission within the United States, but the spread is limited to specific communities in California, Washington, and Oregon. So we have not seen any person-to-person spread in Texas. There have also been reports of at least 2 deaths in Washington state. The March 1st WHO situational report is showing that there are 62 cases in the United States. These numbers are small compared to the nearly 80,000 cases that they have reported in China and the 7,000 reports in other countries. So we still have very few cases in the United States relative to what we're seeing in the rest of the world. What I'm going to do now is pass this over to Dr. Ron Cook, our health authority, to talk a little bit about the disease. Dr. Cook.
Thank you, Catherine. So what is this coronavirus? Coronavirus is one of the coronaviridae, which is an infectious virus that causes lots of respiratory infections. You have already been infected at least once. If you've ever had a cold, a common cold, you've already been infected with a coronavirus. So it goes from very mild disease to the very severe disease like we see in SARS and in MERS, which is the Middle East respiratory virus, and SARS stands for severe acute respiratory syndrome. So it has a broad spectrum. So what's new about this one? It's called a novel virus this time because it's normally carried in animals. So in China, in Wuhan, China, the virus was found, or they think it was found in an open seafood market, and they also sold animals. And so that's where they think it came from. So the virus kind of lives around in animals, and somehow it's transferred to humans. So now this is the first time we've seen this particular coronavirus in humans, and that's what's new about it. So we don't know exactly how it works, what medicines will work against it, and also how it presents the disease. Now we have China to compare to, but outside of China, we don't know exactly how it shows up and what its symptoms are. How is it transmitted? Well, somebody coughs, so it's really person to person. So respiratory droplet is how we think that it most commonly is transmitted from person to person. So that 6-foot bubble around you, so whenever you cough or sneeze, that 6-foot bubble, and somebody walks by right when you cough or sneeze, that's perhaps how you got it. And what are the signs and symptoms? The signs and symptoms are just like the flu virus, although this is coronavirus, so I don't want you to confuse that. So lots of fever, muscle aches, joint pain, headache, nausea, vomiting, diarrhea, just like you felt like you got run over by the bus. That's what this is going to feel like. Just like the current flu virus that's running around that we're at the peak of right now. So the important thing here is if you've not had your flu vaccine, please go get it. It is not too late to get your flu shot. So that helps us differentiate between whether or not you have the flu, or if you come down with a new virus or the new syndrome, that it helps, well, you've had the flu vaccine, that we can say, well, maybe this is related to coronavirus. What are the unknowns? The unknowns is we really don't know how fast it spreads. So flu spreads about if I have the flu, I'm likely to give that to 1.1 or 1.3 persons. So in this particular case, what it looks like, one person that has coronavirus might spread it to 2 other people, and then it grows exponentially, right? That's why it blooms so fast. This is relatively slow, very low, compared to norovirus, which is from poor water sanitation or on cruise lines, those cruise ships. That norovirus is about 1 to 3, 1 to 6 persons. And then measles is 1 to 15. So if I have the measles, I can easily give it to 15. So that's a rapid bloom of the disease. That's why it spreads so fast. This one is very much like flu, not much different than flu. So how do you protect yourself? Wash your hands. Wash your hands. And I'll say it 3 times. Wash your hands. Make sure you wash your hands. If you are coughing and sneezing, make sure you cough into your coat. Make sure you cough into your elbow or use a handkerchief or a Kleenex or a tissue and throw it away. Then go wash your hands. Use hand sanitizer if possible. So stay away from people who are sick. Do your best. Now, if you're ill, here's what you do. You don't go to work. Don't go to work. Stay home if you think you're ill. Please don't go to work. Please don't go to school if you think that you're ill. Stay home. About 80% of the people that came down with coronavirus thus far have mild to moderate disease. Mild to moderate disease in 80%. And that doesn't include the people that are completely asymptomatic that may have it or carry it and don't get it. That doesn't include those. About 80% will do very, very well. If you have advanced age, if you have what we call comorbid conditions, so if you have uncontrolled diabetes, you have emphysema or COPD or heart disease, those things set you at greater risk for a poor outcome. And so right now, the death rate for coronavirus is about 2%. That's pretty low. That compares to our flu virus that we had last year, 18-19. We don't have the flu, all the data from the flu virus this past year, or this current year. But last year, 18-19, about 2% of the people passed away from complications from the flu virus. Right now, with coronavirus, it's the same. So we don't need to panic. We need to take care of and do good personal hygiene. If you're sick, stay home. Don't pass it along. And let me pass on a myth here. Masks aren't really going to protect you unless you're taking care of a sick person. Okay? Don't go out and hoard a bunch of masks. Masks are for sick people or those individuals that are taking care of sick people. Okay? If you are sick, let me give you some worrisome signs that you should call your healthcare provider. Worrisome signs are lethargy, inability to eat or drink, dehydration, rapid breathing, rapid heart rate. Those are all worrisome signs. Temperature that's not controlled well with Tylenol and ibuprofen. So if you are sick and those are some worrisome signs, you develop those, please call ahead. Just don't show up. Okay? Call the ER, call your primary care office, your provider's office, and give us a heads up so we can deliver the best care possible for you. That may mean putting you in isolation away from the healthy population that's in the clinic or in the ER. Please give us a heads up. Give us a call, okay? That's all that I have for now. We'll hand it back to Catherine, and we'll be glad to answer questions at the end.
Thank you, Dr. Cook.
You're welcome.
So Lubbock, like other cities in the U.S., is very mobile. We have residents who travel for work, educational purposes, leisure, vacation, and with that there's always the risk of introducing new diseases into the community. However, a core function of our public health department is to control communicable diseases. We receive over 12,000 reports at our city health department each year, and those all require some type of investigation. The department is staffed with a team that fields calls from providers. We monitor trends and conduct disease investigations on a daily basis. This group evaluates the infectiousness of patients and also makes recommendations for control and treatment to individuals, families, our schools, our hospitals, and our nursing homes. Coronavirus has raised our level of alert at the health department, but that core public health work that we do day in and day out has not changed. These practices will work to limit the transmission of coronavirus in our community. So during this time, the goals of the health department are to inform our local healthcare providers so that they can identify those who are at risk. We want our doctors and nurses and our clinics to be asking patients about travel history and identifying those who are still really most at risk. We also want to notify the public about the risks of coronavirus and how to reduce that risk. And then we're also going to be investigating all suspected cases of coronavirus. And a suspected case is an individual who has fever, upper respiratory symptoms, and travel within the last 14 days to an area that has known coronavirus transmission. So for the most part, that's looking at traveling to Asia. Providers are required to report any suspected cases to the health department. So we will get any calls of people that fit this criteria to the health department. And for any suspected case, the health department is going to take the following steps. We will follow the state and federal guidelines for assessment and testing. If it is determined that a person could have coronavirus, that person will be isolated, tested, and monitored. We will also begin contact tracing, and this is the process of identifying those who have been in close contact with a suspected case, evaluating their health status, and then monitoring those individuals during the incubation period. And these steps are all going to be taken or will be taken to interrupt any human-to-human transmission. If we get a case here, we want to prevent that person from infecting others, and we want to identify anybody that has been potentially infected and keep them from spreading the disease even further. And if we have a confirmed case here in Lubbock, we will notify providers through a health alert and the community through a media release. That patient that may be a confirmed case will be provided medical care, and really depending on their severity of their illness, like Dr. Cook said, 80% of the people will have mild illness. They'll most likely just be at home sick, and we will tell them that they're not to leave their house. And then for some individuals, they might be isolated in a medical facility. If someone has traveled to an at-risk area and they have fever, upper respiratory symptoms, they can also self-report by calling the health department, and we will follow similar steps. And really, it's important for anybody who's traveled and has developed these symptoms to self-isolate and either call their primary care provider or the health department, and we will work through the testing process. And I'm now going to pass this over to Mr. Atkins, our city manager. Thank you.
Thanks, Catherine. Appreciate it. So, first off, thank you to everybody for coming today. We're going to talk a little bit now really about the preparations that are behind the scenes. Before I begin that, I do wish to recognize we have Mayor Pro Tem Griffith with us today, Councilmember Joy, Councilmember Christian as well, and I see numerous partners that we have in the various educational institutions, law enforcement, and others, and we appreciate you being here. It's very important. So, first, as you've already heard today, our Public Health Authority, Dr. Cook, and the Department of Public Health, they're the lead for any situation or potential situation such as this. What that does then for the rest of the city, for the Office of Emergency Management and the other 2,300 people here, is we are here to support and to back them and to ensure that if there was to be a large-scale outbreak, those critical operations of the city continue to function. The plans for this, as you've already heard, Catherine referenced the H1N1, which I believe was 2009. Plans to do this they're long-standing and they're well-tested. They work, and we will follow those plans. They will obviously update, adapt if need to whatever might be unique about this particular situation, but just know that they're there. Know that we've used them before, and we'll continue to do that. For the Office of Emergency Management, where we stand today, we do have already in place our contingency plans if it were to become necessary to activate our Emergency Operations Center. If we do that, the first and the primary focus is on Ms. Wells, Dr. Cook, and the various teams that work with them, which would include all your local healthcare providers. If that were to occur, we think first, we would likely be in a position to help disseminate information, provide education, and respond to questions. Anytime there's such a thing as this, the questions will come and we'll be there to help. But that very same setup is what we would use to help provide resources, to address any gaps that may be identified, and if it were to come to pass, we can draw on other local, state, and federal resources if needed here in Lubbock. We continue to coordinate with our educational partners, and as I've already said, several are here today, and thank you for being here. We will continue to coordinate and to work with them. You've heard about your health department. They will continue to field the phone calls both from the healthcare sector and from the public, and they will work with any and all to do that. Kind of behind that stack of activities is what we call COOP, and COOP is continuity of operations. We have our continuity of operation plans. Know that those encompass all of the essential services of your city. What those plans really do is tell us if we were to have a large number of our workers that had to call in sick, be that public safety or otherwise, how do we continue delivering those services? Those plans to roll the people in and out of those operations to continue to do that, they're here as well. Those are practiced. Fortunately, we've not had to put them into play for real, but we're prepared to do that, and we absolutely will if it comes to it. Local employers would encourage you, and this includes healthcare, it includes education, review your similar plans and just be prepared. Citizens, you've really heard today some phenomenal advice, and there's nothing that I can add to it, or to build on it. But know that your public health department, your public health authority, and the entirety of the city of Lubbock, we're here, we're prepared, and we're ready to help if needed. So with that, I'm going to end, but we are going to take some questions for a while. So Dr. Cook, if you don't mind coming back up, and possibly Catherine, and these are the experts, so I'll facilitate those questions, but please, feel free. Amy? Ma'am in the back?
Did it start from spread from animals to humans?
That's what we believe. That's in my research on the disease process. Yes, it started over in Wuhan, and these viruses live in animal vectors, and it's when they jump from an animal to human is that they call it new novel. This is a novel virus for us.
Do we worry about our
No, I don't think so. I think we have enough experience with our current pets, and most of our pets are seen by our veterinarians, and I think the veterinarian group would certainly let us know. I don't think so.
Sarah?
I'm Sarah Glow, Gathering Journal. I was wondering, what is this testing process like, and how quickly would we get results of that if there was a serious concern case?
Catherine?
The testing process is that if someone is a suspected case, so they meet that criteria of travel, fever and respiratory symptoms, we would request testing through our state health department. The state health department would then sign us a number to allow that person to be tested. And today they announced that that testing can go to our LRN laboratory that's here in Lubbock, so that will speed up some of the testing. I don't know if Dr. Webb, do you know how long the testing takes? This is Dr. Webb from Texas Tech.
I'm a biological threat coordinator. We suspect that probably 24 hours
Okay.
from the time that we receive it. But it depends on how many samples we get and the
Repeat what she said.
Okay. She's saying that it's going to take about 24-hour turnaround. However, if they start getting lots of samples, that time may slow down.
Good. Next.
Emily Harrison with KLBK News. What's being done at Texas Tech to really study this and make sure that it doesn't leave Texas Tech, that it's very quarantine safe?
I can't speak for Texas Tech per se. We're in right now, Texas Tech and all the healthcare entities are really working to try to ramp up their systems, get their systems ready to go for protection. And if this really blooms large, how do we take care of patients? As far as protection and that sort of thing, I can't speak for Texas Tech in general.
Okay, going once?
What is the likelihood that we could see cases here in Lubbock or Lubbock County?
The likelihood of seeing somebody here is probably pretty real. I don't know when it'll occur. We have to act as if it were going to occur, and that's what we're preparing for. Likelihood's probably pretty high. It's starting to bloom on the coasts, and so we'll see what happens and go from there.
Anybody else? Okay, again, thank y'all very much for coming. We certainly appreciate your time today.
I have a question.
What happened?
It just came to my head right now. Can anyone say anything about Lubbock schools? Maybe how are schools taking any preparation, taking an extra eye on kids, or like how would y'all respond if there's a kid who's traveled and all that?
So that is one of the roles that we're taking up with our emergency management group. So that crew has been in contact with the public schools here, private schools, and with our institutions of higher education. At the moment, for us, it is disseminating information such as what we've talked about today. We will continue to do that. All of those entities have access to the Public Health Department, to your public health authority to exchange that particular information that they may need.
Great. One
One
more
more.
question for me, and you may not be able to answer this, but I know in certain cases like HEB is limiting how much you're selling of hand sanitizer. Is that going to be a reality for others who are here? Is this something we need to worry about, or face masks, things like that?
I don't know that that's something that we can speak to. I would go back to Dr. Cook's comments about the masks. That's been, pretty much prevalent all across the country that they're either limiting or running out of those. But what individual businesses do, no, we don't have that.
We do have lots of soap and water.
Yes.
Good to know.
Okay, now going once. No? Okay. Thank y'all.
Thank
Everybody
you.
have a great afternoon.